My reply would be absolutely not, because the age of pregnancy or childbearing age is 15 to 44. And if we don't have an opportunity to talk with teens about what pregnancy is about, what it entails, what's expected of that, what can happen to you, then we'll have what we have now. A lot of teens being pregnant, as one of the ladies said, the young lady said in the video, is that we're raising ourselves. We're on our own. We're learning on our own. And if we as adults or professionals are not putting ourselves in a place to teach them, then we'll continue to get what we're getting.
It doesn't send a mixed message. Rather, it gives us an opportunity. We have these young folks in the schools 37.5 hours a week. It gives us an opportunity to get into their heads, into their hearts, to help them think differently about their own lifestyles, their own decisions. If nothing else, it allows us to help them not get pregnant again, because having a second baby at 17 or 18 certainly further assigns her to a very predictable and negative cascade of consequences in life. So it isn't a mixed message. In fact, it's secondary prevention. It's finding young people that are already at risk and reaching them, getting to them, helping them have, yes, a healthy baby this time, and then improving their sense of self, their sense of self-worth, and getting them out of high school. If they don't get out of high school, they're going to be absolutely constrained to a very different kind of life and lifestyle. I don't think that's a mixed message at all.
Okay. I know there are some conservative members of our viewing audience who would argue that point with you. But let's get down to brass tacks, if we could, here as we conclude this special broadcast tonight, and that is, what is the key to solving this, Dr. Korones? Is the key beginning with the individual who's pregnant? Is that the taking responsibility for her condition and her behavior and moving forward in a healthy manner? Is that the key?
Supposing I were to ask you, what's the key to solving poverty? You'd be at a loss, because there are so many keys. Now, infant mortality is worse. It's life. And you're asking, how can I improve people's lives? Because a lower infant mortality will follow. So that with a huge moral imperative like that, you start small and you test effect. And once you show that's effective, assuming you do, then you proceed and make it larger. The classes we're seeing, I think they're wonderful, and they need to continue and expand. But we're talking to a lot of people that should be talked to, but who will have normal babies. We're talking about 1.5% of the total births in Shelby County, accounting for 50 or 60% of the mortality. And I'm referring to babies under 1,000 grams, 2 pounds, or under 1,500 grams. So that I would start small. And once you demonstrate effectiveness, and this has been done, it's been done elsewhere. Once you demonstrate effectiveness, why, you'll acquire a head of steam you never had before. I want to assign to designate, to begin with, to designated high-risk women whom I know are pregnant or going to get pregnant. I want to assign a pregnancy companion. And I want her to know, yeah, she can come to this class, but you call so-and-so if you feel such and such, or you need such and such, so that this is her ombudsman. This is her abider. And I think if you started where 60% of the deaths are, you might show an initial decrease. Can you imagine what this community would be like when the newspaper said infant mortality diminished by 20%?
My.
Okay, you can do it by starting on this relatively small population. You don't have to go to every pregnancy. You'd like to, and you'll get there, but that's not the way to start.
And I think that we have an opportunity here in Memphis to make an impact, not only in Tennessee, but I think in the entire world. And our idea at UT is the following. We would like to build up an institute, which at this point we can call fetal, maternal, and infant health. And the idea of this institute is there is not an example now in the world, but we could be the first center in the world, because today we have a cancer center, but we do not have, for example, a prenatal center. This institute could have all of us there, and all of us could come with the same agenda. And after that, everybody, all the different organizations, could really make their contribution by working together and not by working isolating. So in other words, in my opinion, I think that we should put our ego on the side and try to be all part of the same team.
Well, let's talk about how some people can get involved. And Antoinette, I want you to chime in on this. What are ways people can volunteer if they want to get involved in this issue and try to be on the front lines of the fight against infant mortality?
There are several ways people can get involved, and there are a lot of programs and agencies who are putting forth their effort to make this happen. And we're calling this initiative the ABC All Babies Count initiative. Everybody who is involved in trying to help address this issue. Individuals can get involved, whether it's a monetary donation, whether it's volunteering at one of the agencies, volunteering to be a support or mentor for a pregnant mom, or donating items, baby items for babies. Any of those things can be done by any individual in the community. And to streamline it, they can contact my office, which is the Office of Early Childhood and Youth, at 526-1822, extension 246. They could also go to our website, www.shelbycountychildren.org, to find out more information about this initiative. But there is something for everybody to do, and as he mentioned, I see a pregnancy just like they talk about a village raising children. The village needs to start convening once a woman becomes pregnant.
Well, we're going to leave it right there. What a wonderful way to leave it. We want to thank Antoinette Holman, Dr. Giancarlo Mari, Dr. Sheldon Korones, the godfather of this whole subject, and Dr. Kenneth Robinson for being with us. Also, we want to thank Dr. Ann Payne Johnson, who joined us on this very special broadcast of Smart Medicine, a focus on infant mortality. And thank you for watching. And remember, if you want to learn more about the topic of infant mortality and how you can help make a difference, we've got those sites and phone numbers mentioned earlier on our website. It's WKNO.org and smartmedicine.tv. Thanks for joining us. We'll see you again next time.